The silent secret to a stronger heart. Dear patients, today I want to talk to you about something extremely important: the health of your heart. As a doctor, I see every day how small changes can transform lives. And today I'm going to share what I call the silent secret to a stronger heart. Why we need to talk about this now. Let me start with some numbers that might surprise you, but are essential to understanding the importance of this topic. 7 out of 10 people over the age of 60 have high blood pressure. That's right, 70% of seniors live with hypertension. But what worries me most is that nearly 2 in 10 seniors don't know they have this condition. In the United States, cardiovascular diseases are responsible for hundreds of thousands of deaths each year, and hypertension affects more than 60% of American seniors. Globally, we're looking at 1.28 billion people with hypertension, and 46% of them don't know they have it. But here's the hopeful news. This means there is so much room for improvement, and with proper treatment, we can prevent 76 million deaths by 2050. The silent killer, living in your chest. Now I'll explain why we call hypertension the silent killer. Imagine your heart as a tireless pump beating about 100,000 times a day. When your blood pressure is high, it's as if this pump has to work against greater resistance, like trying to squeeze a hose while water is flowing through it. What happens silently in your heart? Over time, this overload causes the heart muscle to increase in size. This is what we call left ventricular hypertrophy. Think of it like a bodybuilder who trains every day. The muscle gets bigger, but also stiffer. In the heart, this isn't good, because it loses its ability to relax properly between beats. Meanwhile, the arteries begin to harden, losing their natural elasticity. It's as if a new, flexible garden hose turned into a rigid pipe over the years. This process happens gradually, over an average of 14 years, before you feel any symptoms. The most concerning part is that 45% of heart attacks are silent, meaning they happen without the person even realizing it. The heart suffers small cumulative damages, creating fertile ground for future complications. The secret is in prevention. Now I'll share the real secret with you. Prevention is far more powerful than treatment. Studies show that for every dollar invested in cardiovascular prevention, we save $18 in future treatments. But the most important thing isn't the money, it's your quality of life. The pillars of cardiovascular prevention. The first thing we need to understand is that our bodies change with age. After 60, our arteries naturally become less flexible, and our heart has to work a little harder. This is normal, but we can help it stay strong and healthy. Prevention starts with strict control of risk factors. In our country, we see that 53% of seniors have hypertension, 33% have high cholesterol, 30% are overweight, and 74% don't get enough physical activity. Each of these factors can be modified with the right strategies. Practical changes for your daily life. I'll give you simple tips you can implement immediately. In your morning routine, wake up slowly, do some light stretches in bed before getting up. Take your medications at the same time every day. Have a breakfast with fruits and whole grains. Set aside 15 to 30 minutes for a morning walk. During the day, use the stairs whenever possible. Every step is an investment in your heart's health. Walk around during phone calls. If you enjoy gardening, great. It's an excellent exercise. Measure your blood pressure regularly and write down the values. At night, have dinner at least 2 hours before bed. Engage in relaxing activities like reading or listening to soft music. Maintain a regular sleep schedule. 7 to 8 hours is ideal. Food as medicine. Now I'm going to talk about something I consider a true remedy: your diet. There's a scientifically proven eating pattern called the DASH diet, which can reduce blood pressure by more than 5 millimeters. Let me explain it simply. What to put on your plate. Fruits and vegetables, 4 to 5 servings a day. Bananas, oranges, apples, broccoli, kale, spinach. The more colorful your plate, the better. Whole grains, brown rice, oats, quinoa, they help control blood pressure and blood sugar. Lean proteins, fish, chicken, lean cuts of red meat. Legumes, beans, lentils, chickpeas, they are rich in potassium and magnesium. Healthy fats, olive oil, nuts, seeds, avocado. What to avoid? Processed foods, they contain a lot of hidden sodium. Excess salt, no more than 1 teaspoon per day. Sodas and sugary drinks, fried foods and foods high in saturated fat. A practical tip, reducing your salt intake to less than 1,500 milliliters per day can have the same effect as one antihypertensive medication. That's about 2/3 of a teaspoon of salt per day. Exercise, the medication with no side effects. I want you to think of physical exercise as a medication that has no negative side effects, only benefits. The World Health Organization recommends 150 minutes of activity per week, which is 30 minutes a day, 5 times a week. For those just starting. Walking, it's the safest and most accessible exercise. Start with 10 minutes a day. Swimming or water aerobics, excellent for those with joint problems. Dancing. Besides exercising the body, it brings social benefits. For those already conditioned, include strengthening exercises 2 to 3 times a week. Tai Chi or yoga are great for balance and flexibility. Do exercises of 10 to 15 repetitions with light weights. Regular exercise can reduce blood pressure by 5 to 10 mmHg, which is equivalent to some medications. Furthermore, after each exercise session, the blood vessels relax and dilate, providing a protective effect that lasts for hours. Caring for the mind to protect the heart. Something many people don't know is that chronic stress can be as harmful as high blood pressure. When we're stressed, our body releases hormones like cortisol, which make the heart beat faster and the blood vessels constrict. Simple relaxation techniques. Deep breathing. Inhale for a count of 4, hold for 4, exhale for a count of 4. Meditation. Just 10 minutes a day can bring benefits. Pleasurable activities, reading, music, gardening, crafts. Importance of social support. Join activity groups. Keep in touch with family and friends. Consider volunteer activities. Attend religious or spiritual activities if they are part of your life. One study showed that socially active seniors have a 50% lower risk of developing dementia and a 30% lower risk of cardiovascular events. Medications, your allies in treatment. Now I'll explain medications in a simple way so you can understand how each one helps your heart. Diuretics, like hydrochlorothiazide. These are like water pills that help the kidneys eliminate salt and water. Imagine your body is like a soaked sponge. The diuretic helps to wring out that sponge, reducing the volume of fluid and, consequently, the pressure. ACE inhibitors, like captopril. These drugs prevent a substance called angiotensin II from tightening the blood vessels. It's as if they keep the hoses of your body more relaxed and open. Calcium channel blockers. These help the muscles of the blood vessels relax by preventing calcium from making them contract. It's like giving a muscle relaxant to your arteries. Beta blockers. These medications make the heart beat slower and with less force, reducing the work it has to do. About treatment adherence. I know it's sometimes difficult to remember to take all your medications, especially when you feel well. But it's important to understand that only 21% of people have their blood pressure truly under control. This often happens because they stop taking their medication when they feel better. Some tips to help you remember. Use pill organizers. Set alarms on your phone. Ask for help from your family. Never stop your medications without talking to your doctor. Warning signs you shouldn't ignore. It's crucial that you know how to recognize the signals your heart sends when something isn't right. Some are obvious, others not so much, especially in seniors. Seek medical help immediately if you have chest pain, any pain, pressure or discomfort in the chest, even if it's mild. Shortness of breath, especially if it appears while doing activities that were previously easy. Palpitations, a feeling that your heart is skipping beats or beating very fast. Dizziness or fainting. These could be signs of very low blood pressure or heart rhythm problems. Swelling in the legs, especially if it's new or worsens quickly. Excessive fatigue, feeling more tired than usual during normal activities, symptoms that many seniors ignore but shouldn't. Progressive fatigue during activities that used to be easy. A dry cough that worsens at night, needing to use more pillows to sleep. Waking up at night with shortness of breath. Remember, in seniors, a heart attack can manifest simply as intense fatigue without chest pain. Therefore, any change in your well-being should be investigated. Special care with medications. You need to know that seniors are twice as sensitive to the effects of medications as younger adults. This happens because our bodies process medications differently as we age. Most common side effects: dizziness, especially when standing up quickly. Dry cough, common with some blood pressure medications. Swelling in the legs can occur with some types of medication. Constipation. Some medications can cause constipation. Important precautions. Always inform your doctor of all the medications you take, including vitamins and natural remedies. Be careful with anti-inflammatory drugs. They can raise blood pressure. Drink plenty of water, especially if you take diuretics. Get up slowly to avoid dizziness. Your active role in prevention. I want to end by reminding you that you are the protagonists of your own health. Every choice you make, from what you put on your plate to how many steps you take a day, directly influences the health of your heart. What really works? Controlling blood pressure can prevent 120 million strokes. Regular physical activity reduces the risk of cardiovascular death by 30%. A proper diet can have an effect similar to medication. Adequate treatment has a cost-benefit ratio of 18:1. A commitment to yourselves. Measure your blood pressure regularly. Take your medications as prescribed. Stay physically active. Keep up with preventive medical appointments. Don't ignore warning signs. Remember, hypertension reduces a person's healthy lifespan by an average of 6 years, but with proper control, you can have a long, active, and full life. A long and healthy life is possible. The silent secret to a stronger heart isn't so secret after all. It's the daily, consistent, and loving care you give yourselves. It's understanding that every small choice counts, that it's never too late to start, and that you deserve to live with quality and vitality. I've seen 80-year-old patients who started exercising and significantly improved their quality of life. I've seen people who changed their diet and were able to reduce their medications. I've seen families come together to support a senior in their treatment and transform not only their health, but that of the entire family. My final message: you have the power to strengthen your heart in your own hands. Don't wait for symptoms to appear. Don't think it's too late. Every day is a new opportunity to take better care of yourselves. Take care of your heart, and it will take care of you for many years to come. And remember, I'm here to help you on this journey. Together, we will keep your heart strong and healthy. Your heart thanks you for every little bit of care you show it. And I, as your doctor, thank you for allowing me to be part of this journey of health and well-being. Take care, and see you at our next appointment.